hold here for just a little while and we'll get going. I see Mike in Vancouver, Washington. Welcome, Mike. Wayne joining us. Wayne Parker, thank you for joining us, Wayne. Taylor Phillips.
Where are you from, Wayne?
Oh. Yeah, if you could, Wayne, let us know where you're calling from in the chat. Taylor Phillips from Spokane, Washington. Armitage for Congress. Thank you for joining us. Deborah D. Piazza wants to know how to add our names. Just add them in the chat and we will make sure to recognize you. Richard from Redmond. Welcome, Richard Perkins. Thank you for joining us. Catherine Liu from Arlington, Washington. Welcome, Catherine. Wendy from Bellingham. Welcome, Wendy. Kenny from Seattle. Wayne Parker from Townsend, Washington. Thank you for joining us. Katie Kaufman from Seattle, Washington. Paula Townsell from Everett, chair of 38th Legislative District, Democrats. Lem and Stephanie Putnam from Langley, Washington. Welcome. Linda Bentley from Olympia, Washington. Welcome, welcome, welcome. Thank you for joining us. Thank you everyone for joining us on this Sunday evening. We hope you are well. We hope your family is well. Courtney and I are working on shout outs from all of you guys joining us from all over Washington, all over the United States likely. Please put your name, the city you're in, as well as what group you're organizing with. That way we can get to know each other. This is a monthly call. It will be once a month. So we are working to organize to win across the United States, especially in Washington. Courtney, is your mic working okay?
Yes, it is.
Awesome. Do you want to take over shout outs? Are you good with that?
I am still having some difficulty getting up on to make it easier for me.
Okay, no worries. Celeste from Olympic Peninsula. Welcome, Celeste. Thank you for joining us. Sherry Davis from Longview, Washington. Let's see. Deborah D. Piazza from Vancouver. Welcome. Tony from Port Angeles. Jason Call, candidate for U.S. Congress, Washington 02. Welcome, Jason. Let's see who else is here. Hello from Nicolette Oliver, PCO in Olympia, Washington. Welcome. Georgia Davenport, 9 Mile Falls, Washington, wholewashington.org. Welcome. Marilyn Chase Edmonds, Karen Chase. Welcome. Thank you for joining us. Nicolette Oliver says, shout out from Nicolette Oliver, PCO in Olympia, and Bernie delegate candidate. Welcome, and thank you for serving as a delegate, Nicolette. Kevin Jones. Kevin says, hi, let's see. Hi, Kevin here from Vashon Climate Action Group and Indivisible Vashon, part of Washington Indivisible Network. Welcome, Kevin. Thank you for joining us. We organize to win together, right? Florence from Olympia, Tenino, Washington. Welcome.
Tenino. That's Tenino.
Oh, thank you. Thank you.
Good to see you, Florence. There's a lot of friends coming in. I spoke to Nicolette earlier. Good to see you here. It's awesome.
We got Karen Chase in the room. She was our Bernie 2020, Washington Bernie 2020 campaign director. Good to see Karen in there, and her mom,
yeah, and
Marilyn.
Yep,
Senator Marilyn Chase, very
state senator.
Mm-hmm.
Yes. It's so wonderful to see so many friends popping in. Thanks for coming, everyone. We'll be starting very soon. And we've got Claire and Pat from Elk, Washington. Elk, my dad lives in Elk, but he's not really into politics, so I'll just keep his name to myself. Donna McKenzie from Longview. Oh, it's a beautiful day there. Little overcast up here in Tacoma. Oh, and Amber's aunt lived in Elk for years. Hey, we're all a close family here. All right. Oh, look, I might be able to see things a little better now. Yes. Elk in California? I don't think so. I think, Erica, I think we're talking Elk, Washington.
Pushing false narratives. We'll take a look.
We are tired of the media spinning the truth. So, oh, ballots went out. Let me see, where did that go? It came across. We are live on Facebook. Please share. Thank you, Kara. Hey, Kevin Jones. Are you from Elk as well? We have a large Elk. Is it a herd? If a group of people from Elk join the call? Kevin from Vashon. Just an Elk enthusiast, apparently. Thanks for being here. Let's see. Wonderful. And Rhonda, do you see? Let's see. Oh, Kevin knows amazing people from Elk. Excellent. I met some wonderful people working out there at the food bank. It was they do wonderful work up there. Very friendly community and surprisingly progressive. Surprisingly, rural, but love it. And who else is joining us? Please tell us your name and where you're at. We'll give you a shout out. We're excited to have you here. Tell us where you're organizing and who you're organizing with. We've got a few minutes until we get the ball rolling. And I'm excited by how many people from all across the state are here. I did speak with a gentleman who will be joining us on YouTube. And we are going to get going here. Thanks for joining us. Rhonda, you want to take it from here?
Thank you so much, Courtney, for getting everybody raring to go. We're having an amazing call tonight. So I'm Rhonda Walker, chair of Our Revolution Washington Bernie Kratz Coalition. Welcome to Our Revolution Washington State Monthly Meeting. These monthly calls are a way for all of us to stay connected in our fight for the systemic changes that Bernie inspired us to fight for. Even though Bernie's campaign is suspended, our movement is stronger than ever and will continue to organize for the progressive values we all share. We have a great lineup of speakers on tonight's call. Representative Pramila Jayapal is here to discuss the latest COVID relief package and what's happening with her Medicare for All bill in Congress. Then we'll get the latest on Whole Washington, the state's universal single-payer effort from Georgia Davenport. Deborah Parker, Indigenous leader and member of the Tuwalip tribe of Washington, will discuss how COVID is impacting tribal sovereignty. We'll hear about the ups and downs of organizing in rural areas from Mariana Everson, founder of Our Revolution Coastal and candidate for state rep in LD 19. And then we'll hear from Taylor Phillips of Our Revolution Spokane and field director for the Christopher Armitage campaign. Lastly, we'll share some great ways you can get involved in some of the actions we're doing. Before we get started, I'd like to ask Our Revolution National Board member, Deborah Parker, to give a land acknowledgement. Deborah?
Can you hear me now?
Yes.
All right. ACM, ACIA. Hello to all my good relatives and friends from across Washington State. Sitsayeltsa Sitsa, my traditional name is Sitsayeltsa. My grandmother is a woman, a Sahobsh woman, and so that puts me here on the lands of the Sahobsh people. I'm a member of the Tulalip tribes. My great-grandfather was Lummi. So I am from the Coast Salish peoples, and it's just an honor to be here. It's been so quiet here in the woods, so I hope that each and every one of you are, home and enjoying your families or enjoying that time. For us, when we go into ceremony, we go into that the quiet time. Usually, the winter time is that self reflection, and so it's a good time for many of us to take a look at our lives and what it means to be human and to live here in the land in which we live, the Coast Salish waters, the beautiful mountains. And so for many of us in this quiet time, I hope you're watching the birds, and it's springtime, so watching the plants come out and getting some fresh air. So just wanted to acknowledge the beautiful life that we live and give thanks to the Creator for all these many blessings that we have. And as I was telling my daughter Kaya, I was telling her that um, the fact that we have a bed, we have a warm house, and that we can share a meal together is such a blessing. So thanks to each and every one of you for being here. Thank you for the work that you do. Just being on this call, I know that when we say we're progressives, to me, I think we're just uh, looking at the whole picture. We're looking at the mental, physical, spiritual, and emotional state of who we are as human beings, and acknowledging the land in which we come from as one. So just thank you, Washington, Our Revolution. Thank you all for this call, and many blessings to each and every one of you.
Thank you so very much, Deborah. That was beautiful. All right. Now let's get back to the call. That was great. I wanted to make sure we give it a little bit more time in that moment. First up is Mike Oles. He is with Our Revolution National, and he is our field director. Mike, are you ready to take it away?
Thank you, Rhonda. Greetings, Washington State. My name is Mike Oles. I'm the field director of Our Revolution. I'm based in Indianapolis, Indiana. And what I love about tonight is that earlier we had our Revolution Massachusetts call earlier this evening. We're out in Washington State tonight. What makes Our Revolution so special and so powerful is that we are literally organizing in all parts of the country, building a unified movement together that will make sure that Bernie's agenda doesn't go away, and that we actually can keep on organizing and keep on fighting to make the political revolution real at the local level, the state level, and at the national level, all working together. And that's what I love about this call tonight, and the work of the Washington State Bernie-crats and the work of Our Revolution movement across the country. And as we think about our work, I want to show tonight our triangle, our organizing triangle. And that triangle symbolizes our united movement together. So we're doing three things together, whether it's at the local, state, or national level. Our revolution's agenda is based on three principles. Most importantly, our foundation. We are fighting and building a progressive movement together that can win the progressive public policy fights that will transform this country and make sure everybody has access to health care. So tonight, Pramila, Jayapal, the fight for Medicare for all, that is something that we are fighting for. The Green New Deal, money out of politics. And in this moment, making sure that we have the best, most possible, most fair and most successful COVID-19 response we can get, so that coming out of this crisis, we have our homes and our families intact and a healthcare system that's going to protect everybody. So together we are fighting for the issues, but we know that to do that, we've got to do two other key things, and that is we've got to elect our progressive champions to office up and down the ballot. A lot of us went out there and fought for Bernie, and we have a whole host of candidates at the local and state level that we're fighting for together to elect the office. We're not just protesting the government, as our friend Jim Hightower says, we're going to try to become the government. And then lastly, we've got to make sure that we have a progressive party in this country. And the work of Our Revolution right now is fighting to transform and improve the Democratic Party at all levels, right? So we're running for precinct. Courtney, who was on us earlier, she's a precinct chair. We're getting involved with our county parties. We're making sure our voices are heard at the state and national level. So together, we are fighting to build a progressive party. We're fighting together to elect our champions to office. And lastly, we are, and most importantly, right, we are fighting on the issue fights that matter most right now. So that's Our Revolution in a nutshell at the local, state, and national level, and hundreds of communities across the country right now. But tonight, I want to focus on just one other thing, and that is the status of the last 20 to 25 states that haven't voted yet for president. I'm here in Indiana. This would have been our week to vote on May 2nd. Bernie was going to be in Indianapolis this week. In 2016, was on stage with him, and that was a powerful event. Obviously, Bernie has been in his campaign. This COVID crisis has transformed campaigning right now. But our revolution and a lot of other groups are fighting to get Bernie votes. We want to make sure that Bernie is voting, that we're voting for Bernie in the states that he's still on the ballot. So from New York, Pennsylvania, Indiana, Kentucky, Oregon, your nice neighbors to the south, we all have voting that still happen. And so we're going to go out and we're going to organize and we're going to phone bank and we're going to try and get Bernie as many votes as possible, so that when he gets his 1,200 delegates, that means that we have progressive power at the DNC level. We have progressive power to really improve and transform the Democratic Party and push the nominee of the Democrats to the left. So by doing this, by organizing for Bernie still on the ballot, we want to make sure that our voice is heard when we draft our platform. We want to make sure we have the progressive platform, that Medicare for All, a Green New Deal becomes part of the Democratic platform. We want to help write the party rules from the left. We want a cabinet full of left progressive voices. The next administration needs to have several progressive voices in it at the cabinet level. And a little wonky, we want to protect against the progressive movement made in 2016, like getting rid of superdelegates, making the process more fair. So we have a whole host of reasons that as a progressive movement, we want to keep on fighting for Bernie. We want to keep, get 25, 30, maybe pull off some big upsets, right? Bernie has suspended his campaign, but that doesn't mean we can keep on. That means we can keep on organizing those. So please join our phone banks going forward. Please help us help build the movement. Let's make the calls to Oregon and Montana and Indiana, and Kentucky, and New York, and Pennsylvania, all these big states, Georgia, that haven't voted yet. We can do a lot of work still to get Bernie enough support at the convention level. So I'm going to stop there, Rhonda, and that's what we're up to at the national level. We'll talk to you soon.
Thank you so much for joining us tonight. Nationals are always, needed to help out in our fight. So thank you very much for taking the time out. I know it's late over there. For fighting for our issues. Now, we want to really give a big thanks to Pramila Jayapal for joining us tonight. So our first wonderful speaker, U.S. Representative Pramila Jayapal, who is serving her second term representing Washington's 7th District. She's co-chair of the Congressional Progressive Caucus and the lead sponsor of the Medicare for All bill in the House. Prior to her election, she spent 2 decades working in global public health, and she brings that expertise to her work on healthcare. Thank you for joining us, Congresswoman.
Rhonda, thank you so much. And to my friend Deborah Parker as well, thank you for your beautiful invocation and your leadership on so many levels. Mike, it was great to hear all the work that's happening across the country. And Bernie Kratz, Washington, Our Revolution activists and advocates, thank you, thank you, thank you. I probably saw most of you at that big rally. It was like the last big event that we did at the Tacoma Dome with Bernie, and I was just so proud to be Bernie's Washington State Chair and his National Health Policy Chair. And I'll tell you something, this is the not me, us movement. And so that means that our work continues on every level. And the work that Bernie has done and that all of us have stood up across the country and across Washington State for progressive values means that we should be celebrating, even as our champion has suspended his campaign. The reality is where we have come to is a result of this movement and a result of the work that all of you have done. And I just know that we're going to continue to build on all of that progress. I want to say that I know that this is a time of tremendous anxiety and uncertainty. And I want to start by thanking anyone that might be on the phone that is a frontline worker, has a family member that is a frontline worker out there in our hospitals or healthcare centers, delivering mail for the Postal Service, our grocery store workers, our sanitation workers, all the people that are out there doing the work so that some of us can stay home and shelter in place and try to beat this virus. And I know that so many of you are facing enormous difficulties, financial difficulties, perhaps worried about your health or the health of a loved one. And so we're holding you close. This is a community of people that care deeply and that understand how interconnected we are. What we are dealing with is unprecedented. In just a few days, we will have lost as many American lives to COVID-19 as we lost during the Vietnam War. And by the end of this week, over 28 million, probably close to 30 million Americans will have lost their jobs due to COVID-19, and a substantial number, it's estimated that 35 million will lose their health care and their health insurance as a result of losing their jobs. In Washington state, we've lost 690 lives. Every single one of them is precious. And we've got about 12,000 reported cases. Folks in my district, and I assume across the state, are on their second or even third month without a paycheck. And the vast majority have not yet received any kind of relief, even as bills pile up and another rent day approaches. African Americans across this country are dying disproportionately. Our tribal nations and territories are constantly left out of relief packages, and immigrants, not only undocumented, but also our dreamers and even legal permanent residents, are precluded from almost every form of relief that we have passed so far. There is an absolute and dangerous lack of leadership coming from this administration, a president who is utterly careless and callous and cruel about who lives and who dies, about the Americans without work and without food to put on their table, about the number of bodies that are being buried in mass graves and the families without access to health care. So we know we have an incredible amount of work to do. And the pandemic, as I was talking to Bernie just last weekend, this pandemic has really showcased all the ways in which our movement knew the systems were broken, all the ways in which the systems that we had really did not fight for working people. And so now it is our time to rise to the occasion with solutions that match the scale of the crisis. In Congress, we've passed 4 relief packages, and we've gotten some relief, the biggest expansion of unemployment insurance in decades, relief in terms of stimulus checks to people across the country. Not enough, but something. We have continued to fight for small businesses instead of CEOs and big corporations. But the reality is, I just have to tell you, what we have done is not enough. Our existing systems are not sufficient to deliver real relief to people. We gave away too much to the biggest corporations through a slush fund for Mnuchin, and not enough to workers who are losing their paychecks or their homes, or small businesses, workers and people who are seeing their dreams and their hard work be destroyed in weeks of economic freefall. Every minute that we do not act is another death, another family devastated, another business shuttered. So I and progressives, our 100 members of Congress who are members of the Congressional Progressive Caucus, which I have the honor of co-chairing, have called for a real relief package, one that guarantees paychecks and benefits for all workers, one that cancels rent and mortgages and student loan debt, one that expands support for childcare workers, an essential workers package that gives generous hazard pay and protects worker standards for all those who are out there working, and a relief package that does not exclude anyone based on any factor, including immigration status. Now, here's the thing. If we are going to beat the virus, we need to keep people home, and we need to provide healthcare, expanded testing, PPE, contact tracing, isolation, all of those things. If we are going to keep people home, we need to ensure that we can stop mass unemployment and keep paychecks coming for workers across the country, regardless of when they will actually be able to go back to work. We cannot afford to have millions more go onto the unemployment rolls. State unemployment insurance offices are doing heroic work, but they are not designed or resourced to meet this level of demand. And nor do we want to disconnect workers from their jobs and force them to go into the unemployment market. So that is why I've rolled out a proposal for a federal paycheck guarantee that would apply to businesses, nonprofits, and municipalities of all sizes. And our white paper was taken by the Senate, including Senator Sanders. And so Bernie and Mark Warner, Doug Jones, and Richard Blumenthal have all introduced an almost identical proposal a couple of weeks after we rolled out ours. My Paycheck Guarantee Act would cover businesses, nonprofits, and municipalities of all sizes, and would stop mass unemployment by guaranteeing paychecks and benefits, plus a maintenance cost for businesses to keep folks on payroll. And instead of using a network of banks that have never been good about getting money out to folks of color and small businesses and the unbanked, we would go straight from Treasury to the business. We would keep people on their payroll and their benefits and allow businesses to quickly ramp up or ramp down if new infection breaks out. And they wouldn't have to rehire and retrain new workers. This is a system that most countries in Europe, and actually a lot of countries around the world, have implemented, because mass unemployment is a policy choice. We don't have to have mass unemployment. We can do like Denmark and Germany and France have done, and we can choose differently and have a paycheck guarantee program. So we are pushing that heavily. The other area, of course, that I'm spending a lot of time on is healthcare. As the champion of Medicare for All in the House, having worked closely with Bernie across the country and our revolution across the country, we have made huge progress. And if this pandemic has shown us anything, it has been how right we are to advocate for universal Medicare for All system. Anyone that was arguing that employer-covered healthcare gave you so much choice and refused to listen to Senator Sanders and I when we said that there's no choice when you lose your job, you lose your healthcare. That is what is happening right now. And that's why 2 weeks ago, Bernie and I rolled out a proposal to have Medicare cover all the costs, healthcare costs, of anyone who shows up for healthcare during this crisis. It's quick, it makes total sense, and it's easy to do. Later this week, I will also be rolling out a set of complementary proposals to not only cover the costs, but to actually expand enrollment in Medicare so that anyone who is recently unemployed would join Medicare. We would also enroll those who are uninsured prior to the crisis in Medicare, in Medicaid, and we would prohibit all cost sharing for COVID-19 prevention testing or treatment, regardless of whether they have Medicare, Medicaid, or private health coverage. So there's a lot to fight for. And there is a momentum now behind everything we've been saying on the need to fix our for-profit healthcare system, the need to get private insurance companies out of this system, and to ensure that everyone's covered. Doesn't matter what job you have, doesn't matter if you decide to leave that job, that you have healthcare. So our work is heavy in front of us, but it's also made tremendous progress because of the work you've done. And so I know we're going to take some questions, but I want to end just by asking you to think of your family, your neighbor's family, the families throughout your community. They needed a champion fighting for them before COVID-19. They need a champion fighting for them during COVID-19, and they will need a champion fighting for them after COVID-19. You are that champion, and I'm speaking to every one of you on the call. You are that champion. We are those champions who will fight for working people to achieve universal health care, and who will make damn sure that the American people are finally and forever put ahead of the wealthy and the well-connected. So thank you for that fight. Thank you for persevering, but most of all, thank you for believing and organizing towards a more just and equitable future.
Oh, thank you so much, Pramila. I know that Amber's gonna has questions ready. Amber, you have some for Pramila?
Yeah, wonderful. Thank you for joining us tonight. I have a couple questions here in the chat. The first one I see is from Rebecca Wells. She is saying that she is self-employed with a mortgage that's not in Fannie Mae or Freddie Mac, and that she is hoping that all mortgage and credit payments can be suspended during the pandemic. Is there any update that you have on that
Yeah,
front?
so thank you, Rebecca. This has been a big issue because, we did put a moratorium on federal housing mortgages and evictions, but not for others. And so Ilhan Omar and I introduced a bill that would do just that. And it would do more than that, actually, but it would cover that piece. And the reality is that this is also, by the way, why a Paycheck Guarantee Act is so important, because at least if we were able to continue to guarantee paychecks for people, we would be able to ensure that they could continue to pay rent and mortgages, et cetera. But I know that people are going on their third month. And so Ilhan and I are pushing for more relief for rental assistance and mortgage forgiveness, rent forgiveness, mortgage forgiveness, and debt cancellation more broadly. Actually, Maxine Waters has been working on a number of different pieces that I've been co-sponsoring. And I think that's the kind of relief we need in the next package. So we are hard at work on that package right now. We hope to be able to introduce that in the next couple of weeks.
And another question I see here has to do with will the CPC start to use real leverage to fight for their excellent COVID relief proposals? I guess we're concerned about progressives not getting a big enough foothold.
Yeah, I mean, look, I think that the thing is that two things I would say on this. I think we are really fighting for that. I would say that there's two challenges. One is that because there is no proxy voting, and because there are the way that bills are brought to the floor are either through unanimous consent, in which case you have to block unanimous consent, which in previous bills, by the way, the last bills that we passed before this one were all based on unanimous consent. So nobody voted no. I know there's some people that think maybe there were some people that voted no on those bills. They may not have supported them, but they didn't block them from going to the floor or being passed. Nobody voted no because it was all done on unanimous consent. This bill was the first bill where we actually flew in. But I think that the challenge here is that it's difficult to organize against a process concern or an insufficiency concern. So what we have to do is organize proactively, because to vote no on testing and PPE was very difficult. We wouldn't have gotten very many no votes. I was willing to do that, but I will tell you that we did a whip count. We probably only had about 10 people because there were so many districts that are hurting across the country, and voting against hospital money and PPE and testing is pretty tough. So what we have to do is turn the heat up on this next package. It can't wait until the last minute. We got a lot of last minute requests from groups across the country saying, vote no, vote no. Well, the Senate unanimously passed the package. So people have to understand what the time frame is here. If the package is starting in the Senate, work on progressive senators first. Every single senator voted yes on the package. If it comes to the House with a unanimous vote in the Senate, it becomes incredibly difficult to get people to vote no. So these are the challenges that we face. But I would just say if we start organizing now for our priorities, then hopefully we can start the next bill in the House and we can have a better bill under a Democratic leadership. But everything is bipartisan right now, and that makes it tough. I'm not going to tell you something that isn't true. That's just the reality of it. There's no process or procedure for us to do some of the things we would normally do. Our leverage is you. It's organizing in the streets in advance of the bill, not 3 days before the bill, but in advance of the bill. And that's what I'm going to ask you all to do with us as we get to the next package.
Wonderful. Thank you so much. I know there's a ton more questions that people wanted to ask, and appreciate your time in joining us. And I'm sure people can contact your office, and we look forward to having you on again. Thank you.
Oh, I think we had time for one more, I was told.
Okay.
Let's get one more out.
Oh, sure. Let me see. Lael White says, thank you for your Medicare for All congressional bill and consistent efforts. Will you be able to endorse Washington's SB 5222 as it could possibly take effect before the federal program and be a prototype for our nation?
Yeah, we had stayed away from endorsing the state bills because we were focusing all our attention on the national, but I am so impressed by everything that has been happening. So we'll be in touch and we'll figure out how we can help not just endorsing, but really helping to push for a state-based solution. And, one thing I would just say is, in order to be effective at the state level, we need the federal dollars. So I did have a bill before the Medicare for All bill that I've given over to Ro Khanna now because I took the lead on Medicare for All, but it would open up federal streams of funding so that if states did pass a Medicare for All type bill, like the one that we're contemplating here, that you would be able to access those federal streams. So I would have you look at that bill as well. I don't know what the number is for that anymore, but it's now Ro Khanna's bill. I wrote it, but it's now Ro Khanna's bill, and that will really help your state efforts as well.
Wonderful. Thank you so much again for joining us.
Thanks, everybody. Have a great night and keep organizing. Keep up the street heat.
Woo! Thank you so very much.
Bye, Rhonda.
Bye, Pramila. Thank you again.
Thank
and
you.
We're going to actually kind of keep with the Medicare for All talking points, but going deeper, like we're talking about, to the state level, the universal single payer healthcare. Our efforts are through whole Washington. And tonight we are talking with Georgia Davenport. She was the founder and she is the field director. Georgia, welcome.
Thank you so much, Rhonda. And before we start, I just want to say I really, really appreciate being on tonight. And I so appreciate Our Revolution Washington Bernie Kratz Coalition and Our Revolution National. You all inspire me to keep in this fight, fighting for the issues that Bernie Sanders has been talking about for decades.
Thank you so much. So you founded Whole Washington in 2017. What inspired you to create it?
Well, actually, it was a little bit of Bernie Sanders and a little bit of all the people who I saw supporting Bernie Sanders. So in 2015, when he announced his run, I thought I was the only person. I felt so alone. I thought I was the only person who supported all these issues. And I went to the first rally in Seattle, and I probably got there about 15 minutes before it started. And the lines were so long, I didn't make it in. And I was standing outside with like 3,000 other people watching on a screen in overflow. And I said, oh my gosh, if all of these other people believe so strongly in these issues, then we have a chance. We have a chance to get these things passed and join the rest of the developed world and offer healthcare from cradle to grave for all the citizens, a living wage, green New Deal economy, and that all the other things that other countries offer their citizens.
Right. And your group tried to pass the ballot initiative 2 years ago, which was a 100% volunteer effort to bypass legislative inaction. Explain how a ballot initiative works and take us kind of through the process your group went through.
Yeah, so we're really, really lucky in Washington state when we have elected officials who refuse to pass important life-saving legislation like single-payer legislation. We have the ballot initiative. We can circumvent them. We have a few Democrats who chair the healthcare committees here in Washington state who take enormous amounts of money from for-profit insurance companies and pharmaceutical companies. And for some reason, I think it's connected, they have never let a single payer bill out of committee. So we believe in the legislative process, but we saw that since none of these single payer bills have ever moved out of committee, that we really needed to do it ourselves. And that's why it's so great in Washington state, we have the initiative process. So we can collect signatures, get something on the ballot, and it passed. When it passes, it's law.
So Canada passed single payer, one province at a time. And that's what this is looking like here. How do you think we can prevent ending up with like a patchwork of different state plans?
Yeah, so we actually, Whole Washington works with an organization called One Payer States, which is a national organization, and they are supporting different organizations in New York and California. I think they have about 20 to 30 different states that they're helping write legislation and organize around that legislation. So there is a national effort to make sure that we have really good bills in place. But I will say that obviously Medicare for All is Plan A. But if we can't get that, we need a strong Plan B, and that's why I work with one-payer states and whole Washington, so that we can ensure that, before even COVID-19, we had 522,000 Washington state residents with no healthcare coverage, zero healthcare coverage, and how many millions more underinsured like myself. So if we can even just start there, that's going to make a huge, huge leap forward in this fight for single payer.
Right. And you mentioned, during the COVID happening now, I know that there's some pressure going out there towards Governor Inslee. Can you go into more in depth in that?
Yeah, actually, someone who's going to be on the call later came up with this great idea called a healthcare happy hour, which we've been doing 2 times a week for, I think, about 3 weeks now. But the idea originally came from One Payer States. Chuck Panaccio, who is the head of One Payer States, and he was one of the people featured in Now Is the Time, which is a great healthcare movie if you want to show it locally, wherever you're at. Now Is the Time. I think it's available for free on the internet. So, but he was in that movie, and through that movie, I got in contact with him, and he had this great idea to pressure governors in each state to pass single payer healthcare as an emergency act, because they've been passing lots of different emergency legislation. So if we could just pass that, cover people right now when they're losing their jobs, obviously insurance should not be tied to employment. This is a perfect demonstration of why that system does not work. So we've been every Tuesday and Thursday at 3 o'clock, we've been calling Governor Inslee, and now we're going to start shifting to calling our representatives as well.
Excellent. Thank you so much. Amber, do we have any questions for Georgia?
I've not seen anybody having any. Do you see any out there, anyone?
Nobody wants to ask about these beautiful red berets.
I see that people are wondering about a Medicare for All coalition of the governors across California, Oregon, and Washington. Cascadia Care is what I think I pinned it, but it would be great since they've been pushed to work on that for the economy, that healthcare would be a natural progression in that.
Yes, that would be wonderful, and I think that they could do it right now. This is an opportunity to really take bold action to cover every single resident in these states. And they could use SB 5222. Actually, California has its own bill that is very similar to our bill, and that's S562, I believe. So most of these states already have legislation just ready to go. The unique thing about SB 5222 is it's fully funded, and it's backed by a funding study by Dr. Gerald Friedman, who, if you're familiar with him, he also did the funding study for the National Medicare for All plan. And also it's been vetted by our Department of Revenue and Employment Securities Department here in Washington State. So it is really, really ready to go.
And I got another question. Shanda is wondering, where do I get that rockin' hat?
Yes, you can actually order them on our website. And the great thing about the Red Berets is they help 3 different organizations. They help Whole Washington, Red Berets Medicare for All, founded by the wonderful Laura Fielding. And also, we always ship USPS. So right now, as you might have heard, the Postal Service is being threatened. So we always ship USPS. So if you order a Red Beret, you'll be helping USPS as well. And that's from wholewashington.org.
Thank you so much, Georgia. And thank you, Amber, so much for the Q&A sesh. We'll talk to you again in just a moment. All right. And now let's turn again to Deborah Parker, former vice chair of the Tulalip tribe and a fierce advocate for strengthening tribal autonomy. She is an Our Revolution board member and served on the 2016 Democratic Convention Platform Committee, where she helped to ensure that Native policy initiatives were included in the party's platform. Welcome, Deborah.
Oh, can you hear me now?
Yes.
Yay, okay. Thanks. Wow, that was beautiful, Congresswoman Jayapal. And Georgia, thank you for all the work you're doing. So we have some amazing folks out taking the lead, helping to make sure that our Americans are covered in healthcare, and that our nurses, when there's a child who needs help, a mother, a family, that they can serve, they can do their work, which is to serve the healthcare needs of American people. And so when we talk about healthcare as a right, not a privilege, for myself as an enrolled member of a Native American tribe, the Tulalip tribes, we know healthcare is a treaty right for us. So while we're out there campaigning to make sure that we're all taking care of it with our healthcare, every man, woman, child, elder, that we're all cared for, we want to make sure that we're also honoring our basic human rights, the treaty rights, the agreements that we've had with our First Americans. And so that I just really want to provide that language for you tonight. So when you're working on these issues, that we make sure that that we're all cared for. And so I want to thank each and every person out there fighting for those rights. When I served on the platform committee for the National DNC on behalf of the Bernie Sanders team, we were able to go across the nation, and we heard the needs of a lot of the medical staff, the nurses union, the need for just to really serve those patients who are coming to them. And I remember a story that really touched my heart, and I want to share that with you tonight. Is there was a child who came in, and their arm was broken, and of course, what are the first questions that the facilities ask? You know, do you have insurance? Are you insured? And the nurse is like, we've got to get this child in here. And they're like, hold on, is this child insured? And the nurse who was presenting to our committee looked at us and said, I couldn't believe that this is where we're at, that we can't just do our job that we're trained to do. And so that really struck, that really struck some chords with me, because I also worked in a health clinic, and I also served our clients. And there were times when they said, well, no, they don't have the right insurance for you to help them. And at the time I was helping for folks to quit smoking. And we know that when people quit smoking, how their health improves, and how much money we save when we have those, our community that are free from toxins in their body, and when they're living their best life. So that's all we're asking for, is the ability and for folks to live their best life.
How is COVID-19 affecting tribes, both nationally and locally?
Well, the Tulalip tribes, we've seen one death, and across the nation, of course, there's many tribes. Some haven't been hit, and folks like the Navajo Nation has, as many of you know, have been hit extremely hard. I think as of yesterday, there were 1,637 coronavirus cases. They've had 59 deaths. And so I know they were able to test 7,393. So they've been getting some testing in, and so some of those numbers have increased. But they're really working to make sure that their citizens, the Navajo citizens, are safe. And unfortunately, what we're seeing for the Navajo Nation is the lack of supplies. The funding that they receive is much like across the nation, the Indian Health Service, where there's an acute nursing shortage, and they're also lacking the equipment in their facilities. So that's what we're looking at right now. And we really appreciate those who have been reaching out and who have been providing masks and sending food. And there's a lot of reservations who don't have running water in the United States. So folks are sending some aid and some help to them as well. So we'd like to think we're a little more modern and supportive of tribal nations and remote areas, but the fact is that we have a lot of work to do. And I also want to include Alaska Native and Alaskans up north and those folks who are in South Dakota and some of the rural areas who really are lacking that care and support. So I'm in 110% in support of that, and I know the National Our Revolution is as well.
Oh, absolutely. How do you think we can best influence the 2020 platform to move closer to our issues, especially, Medicare for all, getting everybody covered?
Well, at the 2016 convention, so many of the delegates gathered, and we had some meaningful discussions. We really held to our belief systems. We didn't. There wasn't there. We didn't go because this was a soft sell. We went there because this is what we fundamentally believe in, and so we fought. We fought like. Boy, it was an emotional time, but we band together, we supported one another, and we kept handshaking. We kept speaking to those decision makers. We rallied around our belief systems, and we weren't quiet. We weren't, when they said you're done, you don't have the numbers. Okay, we accepted that, but we still have the issues, and the issues that matter most to us. And so those are the progressive values that we hold. And so we've continued to let others know that this is important via social media. Also, I want to tell you, I've got some friends at the Democratic National Party, and so they can receive some phone calls as well, and let them know that what matters most to you as well. And I do. I've got my friend on speed dial. She works at the national office, and and she's listening. Actually, she's a progressive as well, so I won't throw her name out there, but she's with us. So we're really just trying to change in that way. And since 2016, we did get this friend of mine elected, or not elected. She got hired into the DNC, and so we're also working nationally to elect progressives up and down the ballots. And every position matters, from from city to local, state. So we've got to, and I know we're helping folks in Washington State, but there's also progressives nationally who are running that need a little support as well. And those are some big seats out there. And so I just ask that we keep working, and that we keep reaching out. It's working. So don't, I know sometimes it gets exhausting, so take a break if you need to, but keep working, keep making sure our voices are heard.
Thank you. I totally agree. So you mentioned, Navajo Nation has the most COVID cases, is from what I hear. How's the best we can support those in need of help the most?
I believe I sent a link to you. I don't have it in front of me. Do you have that?
Yeah, it'll be in the chat, and we'll be spreading it around. Just letting you talk about it here. Yeah.
Yeah, and I think you can go directly to Navajo Nation, and I think that's one of the best sources. That's where I've been sending people as well, to the Navajo Nation to give directly to them. And I know that, if you can imagine 59 deaths, I have no idea. My children have lost some family members on their side of the family, and it is devastating to not be able to hold your relatives and to uplift them. So any bit of love helps. Anything. I know for some of us, it's a real trying time for those who've been out of work. And but again, just sending love, sending prayers. We believe in those prayers. So any amount you can give to, I've given some money too. So we always just hope that people do the best that they can.
Yeah, thank you. I want to make sure we get to some questions out there, if there are any. Amber, do we have any questions coming up for Deborah?
I have not seen any questions for Deborah, but I will check one more time.
There's no one should be forgotten ever. Statements out there, of course, and that's absolutely correct.
Yeah, seems to be all compassion and acknowledgement. So appreciate you joining us tonight. It's very special to have you, Deborah. Thank you.
Thank you so much.
Thank you, Deborah. All right. So then, please give if you can. I just want to make sure, give to its need. But thank you so much for joining us tonight, Deborah. So our next two speakers are both organizing in rural areas of the state, one as a candidate and one as a field director. And they're going to talk about their races and the pros and cons of organizing in rural areas. First is Mariana Everson, the founder of Our Revolution Coastal Washington, and Our Revolution endorsed candidate for state representative in Legislative District 19. Welcome, Mariana.
Hey, thanks for having me. I just have to say that organizing with all of you, Georgia, Rhonda, Amber, Courtney, it's been one of the most inspiring times in my life, and I really appreciate you and all the support you've given me all the way through. So I wanted to tell a story about 2016 for me. Like Georgia, I didn't know that I wasn't alone. I thought I was all by myself, and believing that healthcare was a human right and people should be able to get an education and all of those things. So when I went to my county convention, there was way more people there than I ever imagined, and they were all majority 72% were voting for Bernie. So I found somebody there that I knew that I'd gone to nursing school with, and I contacted her after the convention, and I said, we have to do something. We have to do something. All these people, did you see all those people in Grays Harbor County that want to do this? So she's like, yeah, so let's have a meeting and let's decide what we're going to do. So she and I met at a restaurant and decided that we were going to start a group. We didn't know what it was going to be called, but we were just going to start something, right? And so we decided that even if for 6 months it was just she and I meeting every week or every month, then that was going to be enough, right? At least there was two of us. And so we put on a barbecue. We put the word out on social media that we were going to do this. We went to the lake. We set up the barbecue, had the burgers going and the salads sitting there and, stuff. And 30 people showed up at Lake Aberdeen. We were amazed. We were like, holy cow, all these people. And all those people, a lot of those people are still with us today. And people are that were at that meeting are helping me in my campaign. So even in a tiny little county that's 70,000 people in the whole county, you can find people who are going to organize with you. And I think it's really important to build those relationships with people. So yeah, I didn't know any of those people. I barely knew the lady that I'd gone to nursing school with, right? I kind of knew her, but I knew their values, right? I knew what they were for and the policies that they were willing to fight for. So I built relationships with people and built coalitions with their groups, because there was other groups. And that was the key to getting a progressive revolution in a rural area for us.
That is amazing. And it led you to where you are today. So talk to us about campaigning and organizing in timber country. What are some of the unique experiences?
Well, there's a lot of driving. I didn't figure out before the call, I didn't figure out the square mileage of my square acreage or whatever of my district, but it's about half of Grays Harbor all the way down to the Columbia River. So there was a lot of driving. And so that's ended or paused right now during the COVID-19 pandemic. But I'll expect that this summer I'll have some more driving, which I like to do. But mostly it's a continuation of the organizing that I learned to do with Our Revolution and that small local group that I started, right? It's just a making more connections with more coalitions of groups and talking to people about the issues. And even if we don't agree on everything, there are things that we do agree on. So it's just reaching out, being brave enough to talk to somebody that has a Trump sticker on the truck, whatever, anybody. I will talk to them and I will find something that we can agree on.
Thank you, Mariana. Now let's just quickly go to Taylor Phillips, who is a member of Our Revolution Spokane and field director for Chris Armitage, an Our Revolution endorsed candidate running for Congress in District 5. Welcome, Taylor.
Hi, thank you everybody for joining me tonight, and I'm really glad to be here. I'm joining from Eastern Washington, so our district that Chris is running in is roughly the size of New Jersey, so the full state of New Jersey. And we border the wonderful country of Canada, Idaho State, and Oregon. So we have a lot of different borders that we're playing around with that do affect this race. And we in Eastern Washington in the 5th Congressional District, we have less than 1 million folks that live in the full district. So we have 10 counties in our district. 9 of those are rural. About a quarter of our population is all in one county. And so rural organizing has definitely been somewhat of an experience. And it's really given us the opportunity to reach out to our neighbors, reach out to the folks in these rural districts and say, hey, can we talk one-on-one? Something that we have been really lucky about organizing is getting to visit people in their homes, having them invite their friends and family to meet with our candidate, Chris, and actually being able to open up a circle and have really good conversations about what these policies would look like in real life. We've visited, oh, go ahead.
Sorry, so most of your candidates' district, though, lies in rural areas outside of Spokane. And you've been organizing in places like Deer Park and Elk. Talk to us about the challenges and rewards of doing voter outreach in those areas.
So one of the challenges is definitely rural broadband. That's something that's not accessible for a lot of different folks. And it's also something that there's a monopoly with a lot of these different counties. So if they do have those services offered, they're usually expensive and subpar. And so that is something that we have run up against, especially moving into a post-COVID digital world of the campaign strategy. But something that has been wonderful that was pre-COVID that we're really excited to when we get the stay home, stay safe order removed is going back into folks' homes. Folks like our Elk Indivisible have been wonderful and helped us throw intimate kind of very topic specific fundraisers. We've been a part of a clay pigeon shoot fundraiser, which was really fun. And we spend a lot of time in folks' homes. We've also had the opportunity to work with other small groups that we have a wonderful Resisting Forward group in Spokane that has members all the way in Tico, which is Whitman County. So we were able to organize different full-on days visiting different towns across the district just through these one-on-one sit-downs that people were invited into somebody's living room to just have a chat with Chris. And so it's been really wonderful.
That is amazing. And also, so you were the one Georgia was talking about earlier in the call. Tell us about the online happy hours you and Georgia are doing, where everyone has a beverage and calls the governor.
Yeah, so our healthcare happy hours is a way that people in Washington State, all the way across, it's been wonderful seeing how many different folks are turning out from West Coast, like Orca Island area, all the way back over here to Eastern Washington. And it's been a way for us to stay home and stay connected, but also collectively demand the action that we want to see. So that way we can remain staying safe. Different areas in Eastern Washington are really susceptible right now. So a lot of our rural hospitals across the district are losing money because they're canceling elective surgeries, primary care visits, and then patient therapy. And so that's really pushing us in across 9 different counties to have a response. And so having something like Whole Washington passed would be revolutionary for these hospitals that are already on the brink of collapse because of this pandemic. And so we, with Washington State alone, we have over 500,000 folks who in the last 4 weeks have lost their jobs. And it's now more important than ever that we give them some sort of sense of security. 1/3 of this congressional district had an unemployment rate of over 10%, and that was before COVID. So we're really looking at serving the people, and this is one way for us to do that together because we've heard a couple of folks say, hey, I thought I was alone in this. This is a way for us to show each other you're not alone. you're not alone right now, even though we can't be with each other. And also a way to insert some joy, because everybody brings a different drink. We've had different folks bring different varieties of coffees and teas and cocktails and ales, and it's been a lot of fun.
It's beautiful. And thank you for that being such a beautiful brainchild of yours. It sounds like it's going wonderfully.
Yeah.
Let's go to Amber again, and let's get some questions going for Mariana and Taylor. Anything out there?
Yeah, I have a question on how can we donate or volunteer for your campaigns?
Well, I'll go first. I have a website. It's marianaforthepeople.com, and there's the ability to volunteer there, and the donate link is there. I also have, of course, all the social media, Mariana for the People on all the platforms except for Twitter is Nurse Mana, because I am a nurse. And there's one comment in here. I'm going to go ahead and put in the chat my website and my social media stuff. So you guys can see that there.
Beautiful.
Awesome.
Thank you.
I have one more quick question for you, and then we'll go to Taylor. The question is from Tim Gold. He said, as a progressive candidate favoring better healthcare, I hope that you also favor basic environmental quality measures like protecting water quality and reducing air pollution. He volunteers with the Sierra Club and is interested in finding a good candidate to endorse in the 19th LD.
That'd be great. I'll put my email address there, and I'd like to connect with you, Tim. I definitely support all environmental quality measures. If I was running for a national level, I'd be a Green New Deal activist. So, yes, definitely, I am interested in saving our future for our kids, right?
And then for you, Taylor, how can people get in touch with the Armitage campaign?
So I put it into the chat. You can reach us on our website. When you go to our website, you'll immediately see a donate link. And if you're interested in volunteering with the campaign, you can email me directly at taylor@armitageforcongress.com, and we'll be excited for you to join Team Army.
Awesome. Thank you guys all so much. Thank you, everybody in the chat. You've been amazing, and happy to have you all joining us this evening. How can they stay involved, Rhonda?
Oh, well, let's see if Courtney is able to jump in. How's it all going over there, Courtney? You have the calls to action. You ready to go?
I'm here.
Let's do it.
All right. So thank you for joining us today. And we wanted to remind you that we have daily community organizing and training meetups. The links are on our Facebook event at Our Revolution Washington Bernie Kratz Coalition page. We are there every Monday through Friday. And if you have a particular need, want to organize a chapter, feel free to schedule with us at WashingtonBernieKratz@gmail.com. Otherwise, you can just drop in and see what we're doing. We also have weekly local Sunday meetings at this time every Sunday, with our fourth Sundays being these statewide Our Revolution national supported calls. So join us every week on Sunday nights at 7:30 to keep abreast of what's happening in Washington. Please sign up to phone bank or text locally. We currently have a Thursday evening phone banking. There's training and rehash at the end. So do join us for that. And then join us every Saturday evening for our topical town halls. On the 2nd of May, we will be having a May Day town hall. And the following on the 9th, we will be having an anti-corruption election town hall. I also want to take this opportunity to enthusiastically encourage you to file to be PCO, Precinct Committee Officers, between May 11th and May 15th. Take that space, and let your voice be heard in the party, and do our parts to reform. And as a Precinct Committee Officer, elected, appointed, or just an enthusiastic neighbor, reach out to your neighbors, see how they're doing. Of course, practice proper social distancing as you do it, and discuss with them what they need, what they have, what they can share, and talk about growing food. Because if this isn't telling us we need to be prepared for the worst, I don't know what will. We need to start growing our foods and increasing food security. So thank you so much for joining us. Rhonda, back to you.
Thank you, Courtney. So it's important during this time of physical distancing that we stay connected through our organizing calls. Be sure to join Our Revolution National Organizing Call every Monday evening at 5:30 p.m. Pacific time. You'll hear from progressive leaders, keep up with what's happening in the field and in local elections, and learn about new organizing tools. Tomorrow's call will feature Semlis Lopez, an AOC endorsed and Our Revolution endorsed progressive candidate for Congress in New York's 15th district. Be sure to RSVP. You won't want to miss it. Thank you to our inspiring speakers and to all of you for all that you are doing to build our revolution. Before we sign off, let's do our chant. Now, in case you haven't been to one of these before, our chant is, when we organize,
We win!
Right. So are you guys all ready? 1, 2, 3. When we organize,
We win.
we win! Stay safe and healthy, and don't forget to vote. Thank you all.